Hello everyone, and welcome to this audio podcast. In this sort of follow-up series, really, as part of the Ballistix edition. This is the Shientist in this sort of collaborative with and between Storm Robotics Productions and RPSG and where there's RPSG and KDOS Collaborative, and this is an audio podcast as part of the audio podcast series surrounding the SZ Loci Equinox, and I thought as part of this particular audio podcast series, I thought I'd highlight sort of an overview in relating to a particular or specific sort of nephrology focused condition referred to as Alports Syndrome. And here I'm gonna in this audio podcast, I'm gonna highlight some bases around Alports Syndrome, but also what are also sort of the types, the sort of genetic types, the genetic or molecular biology bases around Alports Syndrome, some context around X-linked Alports Syndrome, autosomal forms of Alports Syndrome, the signs and symptoms surrounding Alports, the diagnoses around Alports, and some aspects surrounding the sort of recommendations and and aligned to sort of recommendations, some sort of typical findings in context related to biopsy for those sort of diagnosed with form of Alports. And I'll be highlighting some aspects in relating to in regards to the sort of treatment and sort of treatments, and then there will be sort of a summary as well. And so to begin with, Alport syndrome is really is really a sort of a sort of a syndrome, or a sort of a health condition that has a sort of rare genetic or rare sort of a rare basis, but also a sort of genetic predisposition where where there are specialized basement membranes surrounding surrounding Alports that are identifying in certain tissues in context of human physiology, and thus being in the kidneys, in the ears, and in the eyes. And it is a hereditary disease surrounding the glomerular basement membrane, characterized by the familial occurrence of progressive haematuria and nephropathy. Around 0.3 to 2.3% of all patients reach eventually in context of Alports reach end stage renal disease, associated with mutations in one of the genes, is COL4A3 and COLA4A4 on chromosomes 2, or COL4A5 on chromosome X. And microscopic haematuria is perhaps one of the major signs surrounding Alports. Other sort of signs can be, but are not completely distinctive in relating to Alports, can include proteinuria. And with proteinuria, there's literature and evidence to indicate or inform that there is increase that Alports is more prominent or evident in those with sort of increasing age, alongside as part of the diagnosis, and with that as well, there's evidence of renal insufficiency, and there's also presence and severity of external symptoms as well. So, for example, in Alports, there is evidence of where people where the diagnosis surrounds deafness and also ocular changes as well. Alongside this, there can be evidence that the disease damages sort of the tiny or small blood vessels. That is the blood vessels that lead to and from the kidneys. So from a pathophysiological basis, those blood vessels that are linked to the afferent and efferent arterioles, and also Alport syndrome can cause or does cause damage in kidneys by attacking the functional components of the kidneys as well, thus the glomeruli. And mutations can cause changes in collagen as well, and collagen is generally responsible for normal structure and for structure and function of kidneys, eyes and ears as well. So one of the questions that comes up that has come up through the works around this is, what are the genetic types of Alports or Alport syndromes? So there's an X-linked Alport syndrome referred to as XLAS. There's autosomal recessive Alport syndrome, which is ARAS. And there's autosomal dominant Alport syndrome, or ADAS. X-linked, in context of X-linked Alport syndrome, generally accounts for about 85% of sort of the total AS cases. It has a predominance in those from the male background, and proteinuria appears to be evident in children or pediatrics or young people, and increases increases steadily with age, and has been observed alongside where the symptoms can look similar to sort of nephrological conditions such as nephrotic syndrome or nephrotic syndrome, and generally there is a link to sort of a link to where the where Alports again leads into end-stage renal disease. There can be asymptomatic paramacular yellow dots or flecks that are specific markers of Alports. Analysis of type 4 collagen chain expression in the kidney and skin basement membranes can be sort of identified using using and implementing particular markers of the disease, including through monoclonal antibodies. Without treatment, and 90% of males develop renal failure as they get older. Females develop renal failure in context, at least in this context. Females develop renal failure less frequently than the male counterparts in context of X-linked Alports syndrome. So in context of autosomal Alports is associated with a homozygous or compound heterozygous mutations, where there's heterozygous mutations in around the mutation in around COL4A3 or COL4A4. And again, the disease is perhaps more severe in females in females versus males, at least some aspects of this form of Alports. Early progression toward end-stage renal disease is also evident and linked with where there is hearing defects and retinopathy, and some patients can be free from particular symptoms, whereas many others can display sort of intermittent or permanent sort of microhaematuria, for example, or permanent microhaematuria associated with thin defects around the glomerular basement membrane as well. Here also, just to highlight, in context of autosomal recessive Alports, both parents carry the abnormal gene, and both of them pass that abnormal gene to their offspring, to their child or children. And autosomal dominant Alports is where one parent has the disease, and the parent passes the abnormal gene to their child or their offspring, and only one copy of the mutated gene is required or needed to cause Alports in sort of totality. So we're now going to go into a bit more about Alports and the signs and symptoms. So with all sort of forms of Alports, the kidneys or renal pathophysiology is generally affected through this form of through this particular condition through this particular condition. The blood vessels in the glomeruli, the functioning components of the kidneys, are damaged and generally have and generally there's inability to filter waste from the kidneys, in addition to any sort of extra fluid that can also be evident through Alports. The common signs of Alports as part of the genetic predisposition, really, is where the disease can cause hearing abnormalities and sort of deficits around the eyes around the eyes as well. Blood in the urine, blood in the urine, referred to as haematuria, is also perhaps one of the most common sort of first initial signs, at least from a renal or nephrological standpoint, aligned to Alports, where some of the first signs are sort of evident in Alports recipients. And protein in the urine, or proteinuria, can also and does also occur. There can be hypertension where pediatrics as well as adults who would have been diagnosed with Alports can have issues in and around blood pressure, or arterial blood pressure, and there can be swelling or edema in the legs and in the ankles, in the feet, and sort of around the eyes as well. And the signs and symptoms may differ, but generally it's based on again, where Alports recipients are sort of diagnosed from apart from a genetic basis, also where there's sort of an epidemiological basis in and around age as well as gender, in context of dominant and recessive forms of Alports, and the molecular biology basis in context of Alports disease, and aligned to how it's inherited, in how it can be inherited. in some additional sort of overview around diagnoses. So analysis of signs and symptoms include sort of family history, whether there's a family history pertaining to Alports. There are urine investigations which allow to identify protein and proteinuria and haematuria within the blood. Glomerular filtration rate, or GFR investigations, to understand how well the functional components around the kidneys are filtering waste and toxins from the blood. And kidney biopsies or renal biopsies, which involve removal of a tiny part, a small amount of tissue from the kidneys, with a special sort of needle, and observed under microscopy in sort of sort of pathology based settings, and so that's to help, so that's where scientists are involved in ensuring that appropriate diagnoses is made by the sort of the clinical teams in context of frontline medicine. And there are vision investigations as well, where vision tests to help evaluate the extent of how the eyes in Alports syndrome can or are affected at the time of diagnosis, for example. And of course, the sort of genetic investigations to help confirm diagnoses or diagnoses to help determine the genetic type or the genetic sort of variation of Alports. In context of sort of the main sort of recommendations are aligned to diagnoses, patients with haematuria and sort of a laminated glomerular basement membrane or hearing loss have a probability or have a higher probability to Alports and should be offered genetic investigations, genetic testing for mutations across the three main Alports syndrome genes. Patients with focal and segmental glomerulosclerosis should be sort of offered genetic investigations for mutations in Alports as well, in addition to sort of molecular biology based investigations surrounding podocytes around the kidneys podocytes around the kidneys, but also around how other genes genes or genetics can also be followed up as part of the sort of recommendations around Alports. All three sort of genes or so COL485, COL4A3, and COL4A4 genes should be examined in individuals undergoing genetic investigations for Alport syndrome, and genetic investigations can be sort of performed through what's known as sort of sequence investigations in pathology in and around sort of where there's where there is where most laboratories are sort of equipped to have are equipped with sequence-based investigations for genetics around various sort of diseases, and one of the main sort of genetic investigations that can be implemented or sort of kits, if you like, aligned to a paneling of investigations are done or can be conducted through Sanger sequencing, which is generally quite common sort of way to panel through particular genetic based sort of conditions. Alongside this, here is a typical biopsy illustration and finding. So here the illustration shows a normal what a normal glomerular basement membrane looks like. Then there's an illustration or a biopsy or micrograph really of what a abnormally thin glomerular basement membrane or thin basement membrane looks like with a lesion. And then on the end here, there's an abnormally split and laminated glomerular basement membrane where there's Alports syndrome can be identified or has been identified. And with this, there is podocyte hypertrophy and stiffness of the capillary wall, and frequently observed associated or not with presence of tubular red blood cell casts as well. There's focal and segmental thickening of glomerular basement membrane with progressive enlargement of the mesangial stalks in and around the kidney areas or around the renal pathophysiology. And there's clusters of interstitial foam cells which are frequently found in Alports where proteinuria is also evident. And alongside sort of renal biopsy investigations have also prompted pathology teams, for example, to sort of experiment with the use of immunofluorescence. But in Alports, immunofluorescence is initially negative and generally may not help in sort of the initial parts of the diagnoses around Alports. In context of sort of treatments, there is no specific treatment for those diagnosed with Alports. The goal mainly is to manage the symptoms and help slow the progression around the renal insufficiency, and some treatments can include, for example, angiotensin converting enzyme inhibitors or adrenal receptor blockers, mainly to control sort of blood pressure. Diuretics in Alports in those diagnosed with Alports have been evidenced as sort of treatments that can be used. Transplantation in those diagnosed with Alports is usually successful and is generally considered perhaps one of the best forms of renal replacement therapy in context of Alports sort of more generally as well. Some of the novel treatments that have been sort of documented include sort of where the current standard of care for patients with Alports can include angiotensin blockade in recipients with overt sort of proteinuria. Treatment at earlier stage should be considered especially in males with X-linked Alports who have the COL4A5 genotype associated with early progression to associated where the genotype can lead to early progression into end-stage renal disease, or where there is a sort of a family history as well. Initiation of angiotensin blockade with renal function is normal. Is still normal. Is still normal. However, initiation of angiotensin blockade with can help in sort of in aspects of preserving renal function, and again is generally sort of routine. Is one of the routine sort of forms of treatments, but at the same time the angiotensin blockade can also delay again the onset of end-stage renal disease. In transgenic Alports mice, under sort of laboratory conditions, anti-micro RNA 21 treatment has had reduced glomerular inflammation and impaired renal fibrotic pathways, and angiotensin blockade therapy generally is or has been known to be sort of used and and is is also effective as well. And so in summary, number one, around Alports, there are still issues in the diagnoses, in the diagnoses and management of patients with Alports, from a sort of longitudinal perspective. Number two, the mutation database initiatives could be helpful to explain how mutations around autosomal around Alports can lead to autosomal recessive as well. Number three, whole genome sequencing is and has been promising, because generally it can examine sort of the three different types of Alport genes. Number four, laboratories should seek to improve the sort of diagnostics to ensure detection of mutations across Alports, around Alports, so thus to ensure that along with diagnoses, recipients who are diagnosed have the appropriate healthcare as well. So once again, acknowledge some colleagues in sort of co-developing the outline, and so I got colleagues from an academic basis, and also from the RPSG, RPSG and KDARS, and once again, this has been an audio podcast aligned to this series, the SZ Loci Equinox, and this has been the Shientist, and hopefully this has been an informative basis around Alports. Thank you for tuning in on this audio podcast and on this Storm Ballistix production. Thank you.